Hello friends, welcome back to my YouTube channel. Today I am going to describe about the rapid antigen test, which is very helpful for the detection of COVID-19 affected person very quickly. The application of rapid antigen test in the pandemic of COVID-19 is very important. So friends, if you are interested to know what is this antigen test and how these tests are actually carried out, what are the pros and cons of this test, etc., then watch this video till the end. So friends, let's get started. Friends, as we know that before the vaccine is available, the one and only way to reduce the spread of COVID-19 is to increase the number of testing as much as possible. In this case, rapid antigen test can play a very crucial role. The main advantages of this antigen test are: one, it is very less expensive, and second, this test hardly takes any time. So the affordability and less time consuming will cause more amount of people to be tested for COVID-19. People with positive result can be isolated quickly, which will control the spread of COVID-19. So friends, let's discuss how this antigen test actually works. An antigen is a molecule capable of stimulating an immune response. They may be proteins, polysaccharides, lipids, or nucleic acid. Each antigen has distinct surface features that are recognized by the immune system. SARS-CoV-2, the virus that causes COVID-19, has several known antigens, including its nucleocapsid phosphoprotein and spike glycoprotein, which are visible on its surface. These SARS-CoV-2 antigens are detectable in the upper respiratory tract secretion during the acute phase of infection. The samples for antigen test are being collected from the nasal or nasopharyngeal swab. Sometimes saliva samples are also collected. Friends, collecting nasopharyngeal swab is not an easy job. It requires trained personnel. So these tests cannot be performed at home. Instead of testing the viral RNA, this rapid antigen test searches for the pieces of antigens. After the sample is being collected, it is being processed with reagents to separate out the viral nucleoproteins, which are basically antigens, which will be detected by the test. After that, the processed sample will be applied to the testing strip. In antibody test also, same methodology is being applied. Antigen test use lateral flow immunoassay. An immunoassay is a biochemical test that measures the presence or concentration of a macromolecule or a small molecule in a solution through the use of an antibody or an antigen. The particles in the samples were transported along the testing strip by capillary effect. The testing strip is divided into many sections. The samples are first transported into the section in the sample strip where the nucleocapsid proteins present in the sample is being tagged by some fluorescence labeled antibodies. So these antibodies, which emit fluorescence radiation, will help us to detect its protein in the sample strip. These fluorescence labeled antibodies attached with the antigens which are present in the sample and will form an antigen-antibody complex. This complex will be further transported along the sample strip until it will reaches to the test line. At the test line, there is anti-SARS-CoV-2 antibody which is immobile in nature. This antibody will stop the lateral movement. If the nucleoplacid protein is present, then the test line will be turned positive. If there is no nucleoplacid protein in the sample, there will be no change in the test line. There should be another line appeared at the right side of the test line, which is called the control line. This control line makes sure that the test is valid. This control line has labeled antibodies which binds with some non-antigen target like Streptococcus C antigen, which is normally present in the nasal swab. The antigen test is positive if both control line as well as test line is visible. It is negative when only control line is visible. The antigen test is invalid when only the test line appear or neither of the line appeared in the test strip. Friends, RT-PCR is the most reliable test to detect the SARS-CoV-2 virus. However, antigen test has some advantages. The significant difference between an RT-PCR test and an antigen test is technology and time. For the diagnosis of COVID-19, RT-PCR test takes a minimum 2 to 5 hours, including sample collection. On the other hand, a rapid antigen detection test takes a minimum duration of 10 to 15 minutes for interpreting a positive or negative test. Antigen test is also less expensive compared to RT-PCR test. Moreover, antigen tests do not need very sophisticated laboratory training as compared to RT-PCR, as it is done on a single device. Although antigen testing has these following advantages, it also has some limitations. A rapid antigen test does have a very high specificity, which means that there is a very low probability that the results is a false positive. This means that when a patient tests positive by rapid antigen test, then they are very likely infected with SARS-CoV-2 virus. However, the major drawback of antigen test is its low sensitivity. This means that there is a high probability of reporting a false negative in antigen test. So the true positive results will be low compared to the RT-PCR. So this test will miss many people who are really COVID positive. In spite of this limitation, antigen test is a very important diagnostic method because anyone who tests positive by antigen test can be rapidly isolated and treated. Those who test negative may require additional follow-up, especially when they have some symptoms like fever, dry cough, etc., or if they are in recent contact with COVID-19 affected person. Friends, RT-PCR test is still the most reliable diagnostic method. However, antigen test can reduce the time as well as cost of testing. So testing can be done on a large population to control the spread of virus. Friends, in my next video, I am going to discuss about the RT-PCR test. If you do like this video, then please give one like and subscribe to this channel Chembiosis, where I upload videos on many interesting scientific stuffs. Don't forget to press the bell icon also, so you will get immediate notification whenever I will release a new video. So we'll see you in my next video. Till then, take care of yourself. Bye bye.